Welcome. We're in the office of Dr. Marco Zarbin, the chairman of the Department of Ophthalmology, the University of Medicine and Dentistry in New Jersey. I'd like to introduce you to Dr. Marco Zarbin. We'll ask Dr. Zarbin a few questions as to what we're doing here and how we do it. Doctor, what is the business of a medical school-based ophthalmology training program?
We do research. We teach residents to become ophthalmologists before they go and practice in the community. And we provide clinical care to all different kinds of patients. Patients who have very complicated eye problems, patients who are very poor and have routine eye problems, patients who are very wealthy. We take care of the full spectrum of humanity. And so our three missions are research, teaching, and patient care, but they're all important, and no one is more important than the other one.
Thank you. What research do we do?
In this department, we have major research programs in three areas, which are the three leading causes of blindness in the United States. For example, we have a major research program in diabetic retinopathy that's led by Dr. Monique Roy. It's funded by the National Eye Institute. It's over $3 million program, and the purpose of the program is to identify the risk factors that lead to blindness from diabetic retinopathy in African Americans and other minorities. The important thing about diabetic retinopathy is that although it's the second leading cause of blindness in the United States, there are treatments that are effective to prevent the blindness. The problem is that the treatments generally don't allow people to recover the vision that they've lost. So it's extremely important that people get the treatment as soon as they're eligible to receive it. And even in the wealthiest parts of the United States, only approximately 50% of patients with diabetes get evaluated by an ophthalmologist at an appropriate regular interval. So by knowing what the risk factors are for developing diabetic retinopathy, Dr. Roy hopes to be able to develop programs in which we can target the people who are at greatest risk for losing their vision and make sure that at least those people get the proper ophthalmic care. And the next step of her work is going to involve a telemedicine project which will enable essentially all patients with diabetes to have their eyes checked without even having to go to the ophthalmologist's office. Another major research program is in glaucoma, which is a very important cause of blindness among elderly people. For example, about 2% of people over the age of 40 have glaucoma. About 15% of the people over the age of 80 have glaucoma. And the older part of our population is the most rapidly growing part. Glaucoma is another example of a disease for which there are good treatments, but the treatments work not by bringing back the vision that a person's lost, but by preserving the vision that they have. And unfortunately, glaucoma can take away all your vision, leave you completely blind if it's very advanced. As it's advancing, it's painless, and it takes away the side vision first, and then at the very end, the central vision. So a person can have it and not know that they have it. Dr. Fechner, Robert Fechner, who's the chief of the glaucoma division, is one of the world's leading authorities in the early diagnosis of glaucoma. Traditionally, we were taught to measure the eye pressure, check the side vision, and check the visual acuity, as well as some other aspects of the vision exam to try to figure out if a person has glaucoma. It turns out that there may be a much more sophisticated way of identifying damage to the eye nerve, which is the part of the eye that's damaged by glaucoma, using a technique called nerve fiber layer analysis. And that's exactly what Dr. Fechner is an expert in. Now, it turns out that there's a brand new class of glaucoma drugs that doesn't work by lowering the eye pressure. It works by protecting the cells that make up the eye nerve in a special way. It's a neuroprotective agent. So measuring the eye pressure won't even be a useful way to determine the effectiveness of that drug. But the technology that Dr. Fechner's had a leadership role in developing is going to be exactly how we monitor the effectiveness of that drug. And the last major research program is in age-related macular degeneration. It's the leading cause of blindness in the United States. It affects about 10% of people over age 65, about 28% of people over age 75. Unlike glaucoma, macular degeneration almost never takes away all of a person's vision, but it will take away their central vision, their reading vision, and that's the part of the vision that we need to recognize faces, to read, to drive, and to live independently. And because so many older people don't live with their parents, with their children, as used to be the case, it's a major, not just a major humanitarian problem, it's a major social problem. Because if you can't see to cook or to get to the store to buy food, it's essentially a problem for our society. Fortunately, only a minority of people with macular degeneration lose their central vision. But for those who do, the treatment options are very limited. And we take great pride in the fact that we offer all those treatment options, even the most modern treatment options for patients with macular degeneration. But there are still a lot of people for whom there's no proven treatment. In fact, about 60% to 70% of the people that are at highest risk for losing their central vision don't have a treatment for which they'll be eligible. And at the medical school, we're trying to develop a new treatment, a surgical approach to not just preserving their vision, but to restoring the vision that they've lost.
Who supports the research other than the Lions Eye Research Foundation?
We're fortunate and privileged to receive support for our research from a number of national institutions of high repute. For example, the National Institute of Health, through the division of the National Eye Institute, supports Dr. Roy's research in diabetic retinopathy and my laboratory's research in age-related macular degeneration. The Foundation Fighting Blindness also supports our AMD research. Research to prevent blindness has been a major supporter of all the research that goes on in the department for many years. And there are a number of other institutions, such as the American Health Assistance Foundation, Prevent Blindness New Jersey Fund for the Blind. But even with all of that support, which we are grateful for, we don't have enough research support to do all the experiments and do all the studies that we could do. We're limited by money, not by our energy level or by our intellect. And I think that's unfortunate for the people in New Jersey and outside of New Jersey who are losing their vision from blinding diseases for which there currently isn't any effective therapy.
Wonderful. Well, thank you very much for your time, Doctor.
Well, before you go, let me take a minute to thank you as a representative of all the Lions, because we wouldn't have this department and the research facility that's housed in it without the support of the Lions. The Lions Eye Research Foundation has actually helped build one of the laboratories in our department. The Lions have given probably over $1 million over the past 25 years to the department, which has been used not to take vacations or enrich ourselves personally. It's been completely reinvested in buying equipment to take care of patients, and sometimes buying books to enhance the quality of the teaching program. And I know that when the Lions give, they're taking bread off the table, and that makes it even more valuable to me to have their support. And our department is ready to help the Lions in any way that we can at any time, whether you help us in the future or not, because everything that you did in the past was so important for our survival and our prosperity.
We will be there in the future.
Thanks.
Believe me.